Hi, I'm Lizette, and I'm a school-based speech-language pathologist. In my school, I have a pre-K to 8th grade caseload, and I love using themes and storybooks in therapy sessions. Preschool is totally my jam. I'm also the author of Speech Sprouts blog, and I love to create fun speech therapy materials which I share on TPT. Today, I'm super excited to talk to you about a topic I'm passionate about, which is childhood apraxia of speech, or CAS. So let's check in. How confident are you in your ability to assess and treat CAS? So if you're saying that you're not 100% confident, don't worry, you are not alone. Although we take courses in apraxia in graduate school, most SLPs haven't had the opportunity to have advanced training in CAS. So that's why I was so excited when I got the opportunity to join in on a small group training provided by Dr. Edith Strand of Mayo Clinic. It was amazing, and I'm really excited to share with you some of the takeaways today and then give you some ideas of where you can learn more. Maybe you've had a child like this. I had Joey, which is not his real name. When he came to me, he was almost 4 years old, and he had one word, which was hi. He did speak mostly in vowels, and he used gesture mainly to communicate. I've never seen a child that was that good at charades. Then there was Cheyenne, who also, not her real name, came to me at about 3.5, and she had about 4 vowels that she used and 2 consonants and just a couple of words. Highly unintelligible children. So when you have a child that's highly unintelligible or maybe even minimally verbal, you might be thinking, how do I know if this is CAS or a phonological disorder? So my first tip for you is to watch specifically for the characteristics that are less likely to be seen in phonological disorders and dysarthria and more likely to be seen if it's a child with CAS. Here are 5 characteristics to watch for that are more likely to discriminate CAS. The first one is clumsy or awkward movements when across syllables, like in a longer word like peekaboo. Groping or trial and error behavior on elicited words. And I say elicited because you often don't see that groping in spontaneous speech because that's been over-rehearsed. Vowel distortions. If you see vowel distortions, it's more likely that it's CAS. Prosody errors. You might see equal stress or segmentation. So if you see equal stress or segmentation, you might be thinking apraxia. Inconsistent voicing errors. That you're going to watch for the consistency, particularly in the voicing. So you're going to plan your evaluation. What should that evaluation include? So in addition to all of the traditional things, you're going to get a great history. You're going to want to do an oral mech exam and watch for signs of oral apraxia. You are going to want to do a standardized articulation test if the child's capable. And I'd also advise that you go ahead and do a language sample. So in addition to those, I highly recommend that you do a dynamic motor speech exam as part of your evaluation. You might be wondering, what's that? Simply put, in a dynamic assessment, you're moving progressively from simple to complex words. And when children make an error, you're asking them to repeat the words, which is different than a single word test where you only say the word once. This gives you the opportunity to watch for consistency across trials, and it also gives you the opportunity to provide cueing. So you're going to ask the child to repeat the word, you're going to provide cueing, and you're going to see what level of cueing and what word shapes that this child can be successful on. So cha-ching, that means you have a starting place in therapy. I'll tell you a whole lot more about how to do a dynamic assessment in my blog post series on CAS on my blog, and I'll be giving you those links. Dr. Strand also recently published the DEMS, which is a criterion-based dynamic motor speech assessment. That includes a video training on how to use the assessment, and it also gives you videos where you can practice identifying the different characteristics of CAS. It's a great tool, and I highly recommend that. So based on your assessment, you've decided that this child has childhood apraxia of speech. So what's the plan? The first thing to do is to check and see if the child has these prerequisite skills. Will they imitate your movements? Will they watch your face? And can they sustain attention on you? These are super important. If the child doesn't have these skills, that's where you're going to start in therapy. So with a highly unintelligible child, you're going to want to schedule shorter, more frequent sessions, 3 to 5 sessions per week, individual therapy. You're going to want to choose a small set of words to work on, 5 to 7 words, and include 2 different vowels. They might be words like ow, out, down, hi, bye. So remember, you've already determined what level this child is on and what cues that you can use in your dynamic assessment. So you've got that taken care of. As the child progresses, you can schedule longer, less frequent sessions. You can use more targets per session, maybe up to 10 targets per session. So how do you cue the child? There's lots of research-based methods. There's the Kaufman, there's prompt, there's DTTC. There's not one single method that's best for CAS. The most important thing is that you are cueing the motor movements. And I'm a big fan of DTTC, or Dynamic Temporal and Tactile Cueing, which was developed by Dr. Strand. So what do you do in therapy? Do have the child watch your face. To help them concentrate on that, you might want to put them at eye level with you. One way to do that is I like to take the kids and sit them up on the desk, and then we're eye to eye, and there's not a desk in between or a table in between to distract them. Another thing you could do is you sit on the floor and have them sit up on the chair, and now you're eye level. That way they can watch your mouth and see the movements that you're modeling for them. Do provide immediate, frequent, and very specific feedback on how they're moving their mouth. Do cue those muscle movements from one articulatory position to the other. Do go for a high number of repetitions. The more repetitions, the better progress they're going to make. It's key. Do address vowel accuracy from the very beginning, and start working on prosody as soon as you can. Don't let those habits get ingrained. You're also going to want to fade those cues as the child progresses, and you can start using words that are more complex and have longer syllable lengths. Do involve parents or maybe even teachers or paras if they're available to come to some speech therapy sessions with you. That way you can train them on how to cue the child. Since a high number of repetitions are key to making progress, that really helps, especially if you don't have access to that child 5 times a week. Don't work on sounds in isolation. Remember, it's the movement that we're targeting. So is not targeting movement, but moo is targeting movement. Don't segment your words. Do not teach b, ah, or b, na, na. You want to teach the transitions between the syllables. So you're going to be teaching banana. You can stretch it out a little bit. Just don't segment those words. And also, don't use motivational activities that take a whole lot of time or take too much attention off of your face. You want to keep those motivational activities quick and easy and spend most of your therapy time on those repetitions. Some additional resources where you can learn more. Dr. Strand has a series of YouTube videos that she filmed targeted at parents, but there's some good information in there for SLPs as well. She shows various levels of severity of children with childhood apraxia of speech. Worth watching. For more in-depth training, I recommend Dr. Strand's online training. It's through the Callier Center in Dallas, and you get CEUs. I'll give you that link also. You can also go to my blog and read my series on CAS. I hope this has been helpful, and I hope you're excited to work with your children that have childhood apraxia of speech. If you have any questions or comments, feel free to head to my blog. My email is there, and I'm going to give that to you. Touch base with me on Facebook. I would love to help you if I can. I hope you've enjoyed it, and thanks for listening.